Cool. So really fast, just as a review again. So for the putamen and the caudate, we said it was what? Medium A-spiny neurons. For the globus pallidus interna and substantia nigra reticulata, we said it's long A-spiny neurons.
I thought you said it was medium spiny neurons for the striatum.
That's right. This is your striatum right here.
Yeah, right there you have A-spiny.
Medium spiny or what?
Medium spiny.
Oh, I might have been. He might. I don't know if he put A-spiny or spiny. He might have to confirm in the lecture,
Okay.
just to be sure.
Okay.
Because I wasn't making a distinction with those ones. That might have just been a typo. But
on his behalf.
No, on my behalf.
Yeah. Okay.
Yeah, so that's what I'm saying. I think it would be good to check the lecture, just to be sure. He might have A-spiny for both of them. Or I can just pull it up now and we can just look at it. So basically the basal ganglia is doing two things, right? So it's starting and stopping things, right? It's starting and stopping things. Or it's starting and stopping movements, right? Now there has to be a balance of these two things for normal motion to occur, right? You can't just have it initiating all the time.
Wait, can you go
Further down, or like this? Yeah, so you can't have the basal ganglia initiating all the time. Neither can you have it like stopping all the time. That would be a problem. So you have to strike a balance. All right, and this is the norm. The norm is to strike a balance. If there isn't a balance, meaning if there's an imbalance, all right. So if there's an imbalance, you're gonna have this kinesia. Okay, so so we're gonna get into these kinesias, and I'm trying to look for a chart here. That's the chart I'm looking for. So again, this is just illustrating that it's supposed to be a balance, right? And we're not looking for an imbalance. We're looking for a balance. If there's an imbalance, that's this kinesia. So how can we have this kinesia? So the first scenario is that the basal ganglia is inhibiting too many actions, or it's inhibiting, overwhelmingly inhibiting. All right. So if we're inhibiting too much, then we're not going to get anything. We're not getting any motion. So that's you're going to get hypokinetic diseases or hypokinetic disease. So the hypokinetic disease is caused by inhibiting the direct pathway. All right. So the direct pathway is a pathway that's actually going to lead to, I guess, motion, or if that makes sense. So if we inhibit what normally leads to motion, then we have no motion. That kind of makes sense. So for the direct pathway, and this should be pretty straightforward because we already kind of talked about this. You start off in your cerebral cortex, all right? And then that's going to have an input to your what? Your, the input nucleus of the basal ganglia, which is your what? Your striatum. The input nucleus of your basal ganglia is your striatum. The output nucleus of your basal ganglia is what?
Globus pallidus internus and substantia nigra reticulata.
Exactly. And then from there you go to your thalamus, the ventral anterior and the ventrolateral nucleus. And then you go to your motor cortex or motor area. You see that? So from the cortex to the input nuclei of your basal ganglia, this is going to be positive. We already established that, right? That's going to be what? Glutaminergic, right? Then from the input nucleus to the output nucleus, that's going to be what? Inhibitory. That's right. So inhibitory. From the output nuclei to the thalamus, what's that going to be? It's going to be inhibitory. Remember, we said they were both GABA.
Yeah.
They're both GABA.
But
So
you just inhibited it.
yeah, I see what you're saying, but I'm just talking about the neurotransmitter. Let's just look at the neurotransmitter then.
You just talk about like the direct, like when the output nuclei goes to the thalamus, what does it secrete?
Okay.
Not that it's being stopped, you know.
And then the thalamus is actually going to be positive. So let's just see the easiest way to think about this. Everything that deals with the basal ganglia is negative.
Wait, Moses, I'm confused. Cerebral cortex, right?
Mhm.
Isn't that, wouldn't that be motor areas 4 and 6? Is it going down to go back up?
Yeah, you can see it that way.
Okay.
I mean, because it's different regions of your cerebral cortex. Maybe like because you have to think about what you want to do.
Oh, okay. I understand.
You have to think about what you want to do, and then that feeds into the what's actually going to initiate,
Gotcha.
coordinate that action, and then sends it back to the area of the brain, like, oh, I got to move my head, my feet, and then that sends it to the hands and the feet. You know.
Okay.
You know what I mean?
I got you. So you gotta think about it, process it, then send it down.
Exactly.
And then after 4 and 6, not to jump ahead, I just want to.
No, for you fine, dude. Go ahead.
After 4 and 6 is
Yeah.
when it would go through the internal capsule to go out to like the tracks.
Dude, I've already forgotten that. I'm be
And you
straight.
get movement, right?
Exactly.
I'm just
so
straight
after
up
4 and
what you're
6, the
saying.
next stop is internal capsule and then out.
That's, yes, that would be
Okay.
what would be for you to actually move your leg.
Got you. Okay.
All right. So, do I have everyone? Is everyone here? Is everyone present? Are you guys absent? Are you absent? Okay.
No.
You absent? You present?
I'm present.
Okay. Just making sure. Just let me know if something's confusing. Like, honestly, just ask. I mean, like, we're here to help each other out. So, just feel free to ask if you have any questions, and then if I don't know it, someone else will know it. Okay. So, yeah. Okay. So, this is a point that he mentioned in class. He talked about the Lambo cortical neurons. So basically, these neurons are coming from your thalamus, and they're projecting onto your cortex. It's basically this right here. It's basically this. Like, they start from your thalamus, and then they link onto your cortex. So that's your thalamocortical neurons. Now, if they increase their firing, if they increase like their firing rate, that's going to result in a hyperkinetic syndrome. If they decrease their firing, that's going to result in a hypokinetic syndrome. And that makes sense, right? Because this is having a positive it's having a positive effect on the motor areas. So that should make sense, right?
Wait, the thalamocortical neurons do what?
So it's just the neurons that go from here to here. Like, so if I was to draw a neuron here, you know, whatever, and then this was my axon or whatever, and then it will synapse onto here. That's the one here, okay. Cool. All right, so in order to understand this whole direct pathway, indirect pathway, we need to understand the idea of disinhibition, right? And so the way you want to think about this is that if you're looking at the thalamus, let's say the thalamus, it just has activity, right? There's activity going on there. Now, from your globus pallidus, so remember that the globus pallidus interna was part of the output center, right? So the globus pallidus is going to be what? Is GABA, is inhibiting. Globus pallidus interna is synapsing to your thalamus. Globus pallidus interna synapsing to your thalamus. All right, is GABA, it's inhibitory. So let's just say this guy is normally active, your thalamus is normally active. Now we put the globus pallidus in the picture, right? It inhibits. Now this went from having a whole bunch of spikes, now it's only a little bit of spikes. Okay, so this guy's inhibiting this guy, he only has a little bit of spikes. Now let's put in the striatum. The striatum inhibits the globus pallidus. So he had a lot of spikes, now he only has a little bit of spikes. So if this guy inhibits this guy, then this guy can't inhibit this guy. Right? So then what we can say now, okay, so we went from having spikes to no spikes to spikes. So basically, negative is positive. Right? So at the end of the day, this is still positive. So this is disinhibition. Two negatives makes a positive. That's all that is. So you got to understand that concept. So that when we look at this, right? So when we look at this, we can say from here to here, this is just positive. You see what I'm saying?
Mm-hmm.
Does that make sense? So when you see two negatives, just put a positive on there. All right, so that's that. Okay, now, so we looked at the first condition of hypokinetic diseases, or okay, I'm not saying the right thing. We looked at the first case of dyskinesia, which was the basal ganglia inhibiting too many things, right? So, and in terms of inhibiting, we said if it inhibits the direct pathway, this is how we're getting the hypokinetic diseases or disease. And then we can have a situation where the basal ganglia is starting too many actions. So if it's starting too many actions, this would be hyperkinetic disease. Right. So this is going to be coming from an inhibition of the indirect pathway. I know it's kind of it's a bit hard to kind of think through.
Inhibition of the
Indirect
yeah,
pathway.
because the indirect.
Yeah, so the indirect is stopping.
Yeah.
The indirect pathway is preventing motion. So if we stop what is preventing motion, we get motion. Right? So the indirect pathway, it's just slightly different from the direct pathway. It's just slightly different. So if you guys can just look at this really fast. So we have a cerebral cortex, sends information, right? It's positive, glutaminergic, to the striatum, right? Instead of going directly to the output center, because this is the input, it's output. What we're gonna do is we're gonna go to the globus pallidus externa, all right? Notice this is inhibitory, right? Everything dealing with the substantia nigra is inhibitory. Just think about it that way. Everything dealing with, you don't have to memorize it anymore. Everything dealing with the substantia nigra, the basal ganglia. What was I saying, substantia nigra?
It's late.
Okay, so anything dealing with the basal ganglia is inhibitory. Can you see that?
Or anything dealing
Or
with
actually,
the
maybe,
globus pallidus?
maybe,
No, you can't.
maybe let's eliminate the subthalamus from there. Everything except the subthalamus. I'm trying to understand why would they even have subthalamus on there. Okay, so everything but the subthalamus. But we didn't really have subthalamus. We had globus. We had substantia nigra. We didn't have the subthalamus as part of the basal ganglia.
No, the subthalamus turns on your globus pallidus internus.
Yeah, but we didn't really have it as like.
It's not part of the basal ganglia.
Yeah, we didn't really have it as part of it. We had that the substantia nigra was like below the thalamus, you know. But anyhow, so everything apart from these, everything associated with the basal ganglia apart from the subthalamus or whatever is going to be inhibiting. All right. So for the indirect, so we go from the cortex to the striatum. It's positive, right? So the striatum to globus pallidus externa, then from the globus pallidus externa to the subthalamus, and then from the subthalamus to the output. Right? And then from the output to the thalamus, it's negative again, right? Because this is what? This is basal ganglia. Basal ganglia, basal ganglia, basal ganglia. Ignore this guy. So you can draw this, right? Actually, you can draw this, right? Okay, cool. And then from the thalamus, then you go to your motor area, for instance. Okay, now I just want to give you guys. Let's just think about this, all right? I just logically thinking about this. Okay, so if we want to produce an action at the end of the day, all right, we want to activate this. If at the end of the day we want to produce an action, we want to activate this. If we're going to produce an action at the end of the day, we need to activate the motor area 4 and 6. Okay, so if we're talking about the direct pathway, all right, we're going like this. Do you guys agree?
Yes.
Okay, now, sorry.
No, I was just gonna say it's the direct, so the slide is wrong, that's the direct pathway.
No, they're showing, what they're showing is indirect.
Oh, okay, but the box that you
The
made
box is the direct.
is the direct, right,
Yeah.
okay.
So for the direct pathway, all right, so this is positive. This is negative, negative. So that means that this will be positive. And if this is positive, the thalamus is positive. So that there it is. You get an action. Right? Okay. Now let's look at the indirect pathway. Okay, so this is positive, right? This is negative, negative. So this is what? Positive. Well, okay, I'm gonna take this back. All right, I'm gonna need you guys' help here, okay? So some of this stuff is a little bit, I get confused. All right, I'm just gonna tell you the truth. Okay, so this guy here is inhibiting this guy, all right? And this guy was originally inhibiting this guy. So that means that this guy would be positive.
But is the disinhibition in the indirect pathway, or is it just in the direct pathway?
Well, you can see it as being, anytime you have the two negatives, you would have that disinhibition thing kicking in.
Because I thought the striatum acting on the external encouraged the external to act, and then the external encouraged the subthalamus to act. But
Wait, sorry, say that again? No, because the disinhibition is where you have two negatives. Understand what I'm saying? So, but this guy here, okay, so at the end of the day, this guy here is going to be disinhibited. All right, because the person that was inhibiting him is now inhibited. So this guy has been disinhibited, like he's been let loose. All right, so when he's let loose, he's activating this guy. All right, and if he activates this guy right here, this guy's going to inhibit the thalamus. And if that guy inhibits the thalamus, then you're not getting any action. Do you see what I'm saying? Are you guys see my logic here?
Yeah.
So this is how you think about the direct. The direct leads to an action, and indirect doesn't lead to an action, because at the end of the day, the thalamus is inhibited for the indirect. Does everyone see this? Yes, no, maybe. Maybe I'll see it tomorrow.
Maybe I'll see it tomorrow. For the indirect. I see the direct path.
Okay, so just look at this. Okay, so just look at this, right?
Mm-hmm.
So look, the striatum is active,
Yes.
right? Now normally this guy is inhibiting this guy.
Yes.
Now this guy now is going to inhibit this guy who was inhibiting this guy.
Right.
So because he
now
inhibits this guy,
subthalamus
this guy is now active.
is going. Yeah.
Because this guy is active, he is going to stimulate this guy.
That guy.
If this guy is stimulated, he's going to inhibit the
Blocking
thalamus,
That guy. I'm got it.
and the thalamus inhibits the
I'll see it tonight.
no action. Okay, so did you guys see it? Yes? Maybe? Are you tired?
No, yes.
Did
I'm
we?
nodding my head yes. I
Oh.
understand.
I'm just making sure. I want to make sure everybody got it. I don't want to like.
No, we appreciate it, man.
All right. Okay. Cool. So we're almost through this.
Oh, wait. Do a box around the complete indirect.
Sure.
Here you go. I got you. Oh, no, that's the direct.
so say the indirect one more time,
Sure.
please.
If
I
I get
will,
it
I
right,
will.
most of it's
Well, actually, Carl, how
cerebral
about you?
cortex.
Let Carl do it. Carl, go ahead and do it, please.
So cerebral cortex is stimulating striatum, right?
You want to write? You can write too if you want.
I just want to point.
Go ahead, dude. Do what you gotta do, man.
So, cerebral cortex
is, I'm sorry, stimulating striatum, right?
That's right.
And that is in turn inhibiting global Pallidus externus, the GPE? Huh? Globus Pallidus.
You're trying, man. You're trying.
I'm trying. So then, that is then, which that normally inhibits subthalamus, right? But since it's being held back by striatum, subthalamus is left to run free, and subthalamus stimulates GPI and SNR, right? Substantia nigra reticularis and globus pallidus internus, right? Now, since subthalamus is now stimulating this, this is kicking its inhibitory signal to block the thalamus, and then therefore you have no action.
Look at the inhibitory signal is the one all the way at the end of the axon, or the end of the arrow.
Right.
Yeah.
Does that make sense?
Perfect.
Mhm.
Perfect.
All right, cool. All right, so boom, boom, boom. All right, so if we're inhibiting the indirect pathway, that means that we're getting an action, because the indirect pathway is inhibiting the area 4 and 6, right? Okay, so now if we're getting action by inhibiting the indirect pathway, so we would have a hyperkinetic disease. Right? We're getting too much stimulation. Because we already have the direct pathway, now we're inhibiting the indirect. So it's like we have the direct, which is causing action,
Right.
and now we're inhibiting the indirect,
Right.
which is supposed to stop the action. But now we're stopping what's stopping the action, so now we're getting action and action. Now we're getting all this action. So we have